Hi, I'm Dr. Rodney White and this is the Sarpy Chiropractic Vlog. On today's episode of Kids Corner, I want to address the issue, why does your baby get reflux? First of all, I want to dispel the myth that reflux really isn't normal. Most babies will spit up a little bit, especially if they've consumed a little bit too much milk for what their little stomach can handle. But projectile reflux and happening after every feed is not normal, and it's not something that you want to wait for your baby to grow out of. So what causes it? Now, 90% of cases, it's actually very simple, and it's one or two or a combination of these two reasons. The other 5 to 10%, yes, there can be other more serious issues going on. But what are the two most common reasons that we see as a chiropractor? Number one, your baby reacting to something in your diet. And I'm talking to the mothers at the moment, obviously, when you're breastfeeding. A lot of mothers are hearing attention be brought to this whole milk soy protein deficiency issue going on right now. So clearly, if your baby is suffering from that or just has any kind of allergic reaction or inability to process something that you're eating, then yes, they may get some reflux. The other issue that often leads to it is nerve dysfunction in their middle spine. We see this most commonly from childbirth, the position they were lying in the womb, or certain things that can happen as they grow and get a little bit older. That part is very easy to fix. Find a chiropractor who specializes in treating pediatric patients. They'll apply a very, very gentle pressure to your child's spine, the same as if they were testing the ripeness of a tomato. Usually within a handful of treatments, the problem will clear up. If it's more dietary related, then you need to work out what exactly is setting off your baby. And so often it is dairy. Our bodies, especially babies' bodies, get very, very reactive to it because dairy is very, very inflammatory. So how can you best cut down on the chance of this happening? There's a lot of emerging research that shows if you go dairy-free in the last trimester of pregnancy and avoid dairy for the first 2 to 3 months while you're breastfeeding, the odds of your baby having any of these reactions are so slim. If it's already too late and you're currently dealing with this issue, cut dairy and soy immediately out of your diet for at least 3 to 4 weeks to let it clear the system, and get your baby checked by a chiropractor. If you have any other questions regarding this issue, please contact us or leave a comment below. As always, share the content with anyone else who will benefit. Hit any like or love button as you see fit, and please subscribe to our YouTube channel. Have a great day.